Greetings, friends and followers. This is Nurses Talking. I am Dale Barsey. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I am very, very pleased to welcome Camille Pace. Camille comes to us out of Florida, USA. She's a registered nurse. She's a freelance medical writer. She's an NCLEX test question writer, a proofreader, an article reviewer, and an entrepreneur because she has her own. Yes, she is. She created her own thing. So,
Yeah.
welcome, Camille.
Yes, thank you. Thank you for this opportunity. I appreciate it very much.
It is my pleasure. It is my pleasure. But tell me, what brought you to nursing?
What brought me to nursing? Okay, I don't have a spectacular story. I just remember wanting to be a nurse from a very young age. Um, I remember being grade two, 8 years old. The teacher asking everybody, write down in your cahier what you want to be when you grow up. And I wrote down, you're going to probably chuckle or raise your eyebrows, but I wrote down, I want to be a nurse because I want to give pregnant women needles. I don't know where that came from. I don't know what show or movie I watched, but that's a little bit of what I knew about what nurses did. That's what I wrote down. And throughout my whole young adult, childhood, young adult, I never veered, I never wavered from that. I said that's what I want to be, and I pursued it. It's been a challenge, but here I am. Uh,
Pregnant women and needles.
yes, I don't know where that came from, but I have it written down, and I'm one of those people. I keep a lot of mementos there, so I have it. It's nothing that I would throw away,
Yeah.
and we could look at it from time to time. But yeah,
And
yeah.
so, if I'm not mistaken, your specialty you're a NICU nurse.
Yes. So I've done NICU for quite a while. So probably 18 out of the 24 years I did NICU. I don't work currently in NICU at the bedside there.
Mhm.
I mean, I've worked in a few different areas, but there was an opportunity, probably in my 17th, 18th year of NICU, there was an opportunity uh, to pursue something else there at that time. I was actually in a position. It was just kind of weird. I was in a position, and it was a temporary position, and it was ending. I was covering for somebody for maternity leave, and I was loving NICU, but I was applying. No, sorry, I wasn't applying because there was no positions open. It's like because my plan was okay, when this position ends, I'm going to just apply for the next position, but there is no
Mhm.
position to apply for. So I'm like, okay, Lord, what am I going to do? I mean, at this time, I was been doing NICU for a while, and as you can see, I've done a few different areas of nursing. So I was open to change.
Yeah.
I knew even if I left NICU, I could always go back at some point.
Hmm.
So I just took that as an opportunity. I'm like, okay, what else is out there? And so at that point, I went into teletriage for a few years. But my heart is still with NICU. I'm still a NICU nurse. And now that I am pursuing writing,
Hmm.
I'm revisiting that. And it's like, okay, I've specialized in this area for so long. I'm going to share what I
You
know.
know,
I need to get a little bit more current on some things here. But I'm gonna be using that to with my writing
hmm
articles and stuff there. Yeah.
hmm
Yeah.
So yeah, I brought that up because you said that you wanted to give pregnant women needles, and I thought baby somehow. So she had to get around to the baby somehow. But okay, so since 8 years old you wanted to be a nurse and you never wavered.
Yeah.
When you became a nurse, was
Yeah.
it what you envisioned?
I think it was. Um, I guess the thing is, because I was thinking about it when I graduated from high school. I was young. I was 17 years old.
Mhm.
Graduated from high school. A couple months later, went straight into university, into the nursing program in university. I was very excited, letting everybody know this is what I'm doing. And yeah, this is what I wanted to do. So that's where the challenges started for me. Nursing school, go figure. I was in this program, and there was a course that I failed, a major course. I needed to pass this course. I was like, okay, I'll take the course again, no problem. It was offered once a year, so I had to wait another year. So I just
Mhm.
filled the slots with the other courses that I need, and it came time for to take the course again, and I failed again. It's like, oh my goodness, Lord, what's going on? What am I going to be doing here now? So that was where I came to that fork in the road. It's like, you know, am I gonna am I gonna continue to pursue nursing, or I'm gonna pursue something else? In the end, I mean, I decided I really want to be a nurse. I guess I didn't feel like giving up. It's like I knew I
Yeah.
had some failures and some setbacks, and probably self-esteem, lowered a little bit, and maybe even embarrassed. It's like
Yeah.
going to university, you failed. We're paying this money, you failed. But in the end, I didn't want to give it up. It's like I put all this work in. That's all I've done for the last 4 years.
Yeah.
Still didn't get anything to show for it, but I wanted to complete it. I wanted to complete that. Um, so I got into another program that I guess provided me what I needed, extra clinical hour or more
Mhm.
clinical hours. The focus was just a little bit more what I needed there. And when I went into the other program, that's what propelled me forward. I had teachers that were very supportive. Um, I think there was a shift there in my mindset and in
Yeah.
my understanding of the nursing and principles of nursing. I feel like I went into nursing. I was very young, very innocent, naive, didn't know how much work and effort I probably needed to put in. I could
Yeah.
have put in a lot more effort to really understand nursing. I don't think I really had a good grasp of it at that young age. So I needed a little bit more time. So I got that. And once everything just kind of clicked for me um, in that second program, it's like, okay, I did it. I my confidence was boosted. Um, Even I was getting compliments from the nurses I was working with and my instructor. And in the end, I graduated with all A's, the top of the class. And I just
Mhm.
boldly on that day wore my
You're
gown and like,
flowing.
yes, I did it. Thank you, Lord, we did it. And then just move forward here. And yeah, so it's like, okay, this is what nursing is. This is how you think. This is critical thinking. So it was all coming together there. So once I got over that hump, it's like, okay, here I here I am now.
You've
Uh,
done a bit.
mhm.
What do you think you'd like to see change?
What I'd like to see change in nursing.
Hmm.
I mean, it's a wonderful profession. It's a beautiful profession. I, I don't want somebody's a nurse. I don't want them to leave. And so one of the things that we need to do, we need to kind of nurture the profession. We need more nurses. Um, to get the nurses that we need mentors and we need instructors. We need the nurse educators to be supported because they're basically giving birth to all these students, bringing them to the profession, and we need them. And you know, over the last few years, I'm realizing how much there is a lack of nurse educators, and one of the reasons being is they're not supported. They're not supported with the resources they need. And then probably more important, not more importantly, just as important is the compensation, their rate of pay, the benefits that they
Yeah.
need, just like any other nurse,
Just,
that whether they work at the bedside.
mhm.
And there should be a little bit more of a focus with them because we need more nurses and I recently also found out that how many hundreds of applicants are being turned down.
You're
Um, and,
down.
and that's the sole reason. It's like, oh my gosh, I didn't know. I didn't know. I thought, okay, maybe their grades didn't hit the mark, but a lot of it is due to the lack of educators that we
Ever.
have,
Mhm.
which we need there, and it just kind of propels this vicious cycle we have with
Mhm. Mhm. Mhm.
the lack of nurses that we have, nurses leaving the profession, and at the same time, the community they're aging, nurses are aging, so it's just this vicious cycle, and it's like we need to get a hold of
Mhm.
that there.
Yeah. So you are an NCLEX question writer.
Yes.
How does one become an NCLEX question writer?
All right. Well, I was thinking like with nurses that have transitioned into writing as a whole, I've heard a lot of stories, and I think it's true of myself as well. It's kind of something we kind of stumble into there.
Hmm.
Um, so I guess it was when I was away from the bedside there. This was probably up until 5 years ago. I was enjoying that part of nursing. You
Hmm.
know, it's not a traditional role. I was on the telephone. It's not a traditional role. I was learning a lot, and I was liking that. And there was a time when I was Googling what other roles can nurses do away from the bedside. I just wanted to know what was out there, and then so that's when I saw writing. I'm like,
Hmm.
wow, I didn't think about that there. And then I delved into that a little bit more, and then um, I guess I stumble into like little postings, job postings, I'm like, oh, I like to write. I was a good writer. I remember back in my
Yeah.
universities. And then, so that's what there was a position. It was just a casual position, just saying they wanted some nurses to write NCLEX questions for I think it's for a nursing program, just to help them with their courses. And so I applied and they accepted me. Um, I didn't have any experience writing NCLEX questions. I just said, this is something I want to do. So they gave me like some basic training
Hmm.
and I started writing the questions, and I got the feedback and that's how I grew. So, and and I appreciate all the feedback. That's what made me a better
Yeah.
question writer there.
Yeah.
And so I guess that's how it was. I just kind of stumbled on it, and then you just grow with feedback. Whether it's writing text questions, whether it's writing articles, I guess whatever you do,
Articles.
you got
Yeah.
an editor, you got a team that you work with. That's their position. They want to help you in your position, and you just like if you're in school, you take the feedback and you
Mhm.
apply it and you move forward. You know.
But
Uh,
you say that teaching is your healthcare passion.
yes,
So
yes.
so here is my question then. How did your experiences or how do your experiences as a nurse translate or confirm or influence the way you're teaching philosophy?
Okay. Well, it's funny you say that because I feel I think I can generalize it, but it is specific for me. That is the one thing that people need, our patients need. Like
Hmm.
I got to be a teacher in everything I do with my patients. So whether I'm at the bedside and I'm administering medications. Gotta let them know this is, first of all, I try to assess and see if they know what this medication is that I'm giving them. Some
Mm-hmm.
do, they do a great job, and I I I give them thumbs up for that, and I really compliment them. I'm glad you understand, you know, this medication, you're taking this medication and what it's for. Some have no clue, and everybody else in between. But for those that don't know, I let them know what it's for, what it's going to do for them, why they need to take it at this time of the day. This is the dose. This is the reason why you need this medication. Um, you know, so whether it's I'm administering medication, whether I'm changing a dressing, you know, eventually I'm going to be teaching them, and us nurses are teaching them to, so they can do it on their own when they go home there. So when it comes down to maybe even just looking at the site, assessing the site first of all, so they can tell whether maybe things are going in the wrong direction, or it's, you know, you're moving forward with their healing, and then how to change their dressing, you know, just little things like that. Just everything that I do with them. It's like I'm just teaching them, I'm providing them information, the tools that they need so they can understand what it is they're getting or they're doing. And
Mm-hmm.
that's going to help them in their journey. That's going to make them more compliant, whether it's with their medication, whether it's with their dressing, whatever it is that they're doing, whether other treatments and physiotherapy and ambulating. This is why you need to ambulate right after surgery, even though you're in pain, even though you're really uncomfortable. This is why you need to be moving around here,
Yeah,
you know.
yeah,
So sometimes
yeah.
I feel like I sound like a broken record, but I think about it, and I tell my children the same thing. It's like I'm telling you something. Even your teacher at school, you know, they're teaching you a new concept.
Yeah,
They don't just tell
yeah,
you one time. You're going to
yeah,
hear it a couple times that day. You're going to hear it the next day, and next week, and until you really get it. And when they do that, that's going to help you to really get it and grasp what they're saying there as well.
so one of the complaints that we have when we talk about, you know, nursing shortage and whatever, one of the things that we talk about is, you know, unsafe patient assignments, nursing burnout and stuff like that. And I see that you wrote an article about creating safe patient assignments.
Yes, yes, I did.
You wrote it directed at whom?
Um, I think it was more directed to nurses, registered nurses working at the bedside there.
Mm-hmm.
Just for them to understand the process a little bit there of, first of all, how the assignments are chosen
Mm-hmm.
there.
Mm-hmm. Mm-hmm.
I have to admit, generally, before I wrote that article, I didn't really think too much about it. I mean, I would
Yes.
ask questions here and there, but I'm pretty flexible. It's like, okay, this is my assignment. Sometimes I'll question, I've got 7 patients. This person has 6 patients, or
Mm-hmm.
I have 1 patient, but they're all the way over there, that
Mm-hmm.
kind of thing. But just for them to understand, first of all, how the assignment comes across,
Mm-hmm.
and what is considered safe, what's considered unsafe. Sometimes, you know, maybe if you're a strong nurse, the assignment isn't the greatest, but you're probably like, okay, I've been here the longest. I can do this. I
Mm-hmm.
can do this. But it doesn't have to be like that. We do have to question things from time to time. Um, the, whether the charge nurses or managers, they need to know that when things are a concern there, whether you can
Yeah,
handle it or not. It shouldn't be about taking
yeah,
risks. Everything should be safe across the board, if we can help it. So if there's concerns, they might not be aware of the concerns. So that's why we need to verbalize that and get
yeah,
that point across there, so we
yeah,
can be safe. Because again, that's one of the major reasons why nurses are leaving the bedside or even leaving the profession altogether.
yeah,
I mean,
yeah.
You can understand. Occasionally, you'll have those days where we're short. Somebody just got sick last minute, and we
Mm-hmm.
understand. We'll pick up the slack. We're gonna, wish them the best. Hope they get, recover pretty soon. But when it comes to when it's happening a little bit more persistently and consistently, that's not good.
Yeah, yeah,
So we gotta.
yeah. When I read that article and I thought to myself that was really a very necessary and insightful article, because very often we nurses don't really understand how they got the patients they got, why they got the patients they got, and we spend a lot of time looking at what someone else's assignment looks like
I
as
know.
compared to ours, not fully understanding what went into the process.
Yeah,
And so I
yeah.
thought that was a really insightful and necessary article.
Okay. All right. Thank you. That's
Yeah, yeah. And so you created your own business as a writer, this
yes.
entrepreneur. So what I want to know is what nursing skills, so what skills did you develop as a nurse that translated into entrepreneurship?
Okay. Yeah. So I know in the beginning I chuckled there when you called me an entrepreneur because
Yes.
that's not who I am, and I'm still learning. It's not even anybody I really wanted to be. I'm not a businesswoman. And nowadays when you're going into writing, if I guess you can, have an employer if they,
Mm-hmm.
and just like how we do it, hospitals, and you could have an employer, but a lot of the times you're doing it on your own. You're not leaving your current employer altogether. You're
Mm-hmm.
kind of doing it on the side, what we call freelance health writing.
Mm-hmm.
So it is a business. You need to make
Yeah.
contracts and with somebody there and kind of build that up. So that part of it is like, I'm supposed to tell you or what to pay me. It's like, oh, I don't know about that. So just things like that. So I just chuckle there. So, but the thing is, you got a heart for writing, you got a passion. This is what you want to do. So you're gonna learn those skills, learn how to kind of create your business. You
Yeah.
gotta, if you need a license or not, and making contracts and proposals and
Yeah.
and all of that there. So
Very often we can pursue our passion, but our passion doesn't teach us how to turn that passion into a business or something that makes us
yeah,
money. And that's something else that we have to learn. And so some of those skills that we develop as nurses or whatever it is we're doing have to translate. It has to be kind of like seamless into how do we make our passion a successful business?
yeah, yeah. I mean, you have to like curiosity or,
Hmm.
just trying to find information. So probably for the last couple of years, I would say that I've kind of immersed myself in the community, the writing community,
Yeah.
and specifically nurse writing community. I'm still amazed at how many nurses they've not totally left nursing the bedside. Some have, some haven't, but a lot of them have pursued nurse writing. So there's a community in how we're supporting each other
Yeah.
because, like we just talked about, yes, you're nursing through your writing, but at the same time, for a lot of people in this position, it is a business. So we're just kind of sharing with one another how we navigate that, moving forward. And especially if you have a passion and this is what you want to do, maybe even close to full time, we have to kind of figure out how do we make money from this,
Yeah. Yeah.
That's it's
Yeah.
not really usually we don't even talk about money even with one another there.
Yeah.
So now we're talking about it. We're giving, okay, you got to ask them for this much. Remember, you
Yeah.
have this bill to
Yeah.
pay, you have that to pay, and it has to be even a little bit more than your maybe current rate at the bedside, just all of
Yeah.
that. So just really immersing myself in that community and all the tips that we can share with one another, so we can be successful with this,
Yeah.
if this is what we
Yeah.
want to do full time or close to full time there for a living,
Yeah.
most of
Yeah.
us can't afford to do it free. So, and then I'm just still amazed. There does seem to be a way that we can make a living out of this there. So
Yeah.
yeah.
Yeah, yeah. And all that information that you're sharing comes out of all the hard work you did and those years of experience that you accumulated.
Yes.
Yeah.
Yes.
What advice do you think you'll give to somebody who wants to be a nurse?
That wants to be a nurse. I encourage anybody, the nursing students that are there in the unit, when I see them, if I meet somebody on the street, whatever, if I'm talking with somebody and I find out they want to be a nurse, I said, yes, this is a good profession. And I encourage them whatever way possible. I always let them know that there's a lot of options as nurses, or I tell them for myself anyways, I appreciate the fact that there's a whole bunch of options as a nurse, a lot of different settings we can work in, a lot of different areas of expertise there. So I let them know the sky's the limit. Um,
Definitely.
at the same time, I also let them know that nursing school is hard. It doesn't matter where you go. So I did a program in my initial program in Canada. Then I
Mm,
went back to school to get my bachelor's here in the US. They were both difficult. I let them know for, right off the bat that it's going to be difficult, but just keep pursuing it because in the end it'll pay off. It's a very rewarding
yeah.
profession, and there are a lot of options. So if this area isn't working for you, that's not your gift. Okay, there's something else for you as well.
Yeah.
Yeah.
Yeah. There is. There is. And you can even create your own space. You do that. Create your own space.
Yeah.
So one of the things that we talk about a lot though is burnout. What do you do to care for you? What does self-care mean to you? And what do you do?
Okay. Yeah, I'm not the greatest at that, and I sometimes I said I have to give myself a little grace. I mean, I need to do more though in terms of self-care. I guess maybe that's everybody's story.
Mhm.
Um, but for me, I'm just realizing it doesn't have to be much. I don't have to be jogging around the neighborhood for half an hour. I haven't done that in a very long time.
Mhm.
Um, self-care, it could be 5, 10 minutes here, 5, 10 minutes here. Sometimes that's all I have. I mean, right now I live in a nice area. There's a little tiny lake here, and there's a little
Mhm.
walking path. So I try to do my best to just even walk, brisk walking around there. Do that twice. That's 20, 25 minutes if
Mhm.
20
Mhm.
minutes. And that helps a whole lot there.
Yes.
I thought about it. It's like I recently bought myself a massage chair there. So, because before I would go to a massage therapist and I'd
Mhm.
pay money, and I'm probably still gonna go every so often, but I probably won't need to go as often because I have a little bit of help here at home. It's not the same, not totally the same, but it will help. But even just something. It's a little ball, just kind of rubbing those tense areas. It's like, oh my gosh, this feels good.
And you can do it at your own pace in your own
Yeah.
time. You can do it at midnight if you wanted to, or
And
5
most of the
a.m. or
time,
in your own
most of the
home.
most of the time, that's the time that I'm doing it. I'm a night person, and that's the time when I'm doing it. So just those minutes here and there, good quiet time. I do have a little bit of commute to work, so is I a lot of times I feel that's self-care for me,
Yeah.
just having
Hmm.
that quiet time to think, meditate, to pray, listen. I
Hmm.
listen to my
Hmm.
podcast there as well there. So yeah.
Awesome, awesome, awesome. And you know what, I love that you talked about that. It could easily be just a little time, because
Yeah.
sometimes I think we get carried away and thinking that self-care means we have to do a whole big thing. And that's not necessarily so at all. You can do 2 minutes of really effective self-care.
Yeah.
Yeah,
Yeah.
you
Yes.
know. And that's why I start by asking what it means to you, because it doesn't mean the same thing to everyone.
Whatever, there's 100 different things there. I mean, whatever it is for you that helps you to wind
That
down,
helps you.
helps you to relax. you
Yeah.
know.
Yeah.
Um,
Yeah.
mhm.
Yeah. So I have one more question before we go.
Okay.
If you could tell me in one word what you see as the most effective quality of a nurse, what would that word be?
Effective quality.
Or
So
essential quality?
yeah,
Hmm.
oh, essential. Yeah. So like I mentioned before, number one would be teacher, it doesn't have to be formal. It's just a
Hmm.
matter of providing information to people, to your clients, to your patients. I mean, letting them know the reasons for this, the reason for
Yes.
that. So that's what I mean when I say teacher. That has to be,
Hmm.
first and foremost. And then also being somebody that's curious, that you think about things you might not understand it. It's like, okay, why does it work like this? What does that diagnosis mean? Why are they using this treatment there? So you have to have that curiosity,
Yeah.
that inquisitive mind. I know I didn't, that's not really innate to me. I wasn't really one to ask a lot of questions growing up, but
Mhm.
as you become a nurse, you see you need that quality,
I agree.
for yourself, for your patients. They ask you questions. You say, "Oh, sorry, I don't know. That's a good question. Let me find out."
It's interesting
Yeah.
you say that because when I ask myself that question, that is the word that I come up with, curious. I've always maintained that you cannot be a good nurse if you're not curious. So yeah.
Oh, okay. Yes, yes.
Yeah. Camille, I don't even know how to thank you for this conversation. It's been such fun.
It has
Thank you
been, yeah.
so much for doing this.
Yes, thank you very much. Thank you for choosing, for asking me. I realized, I think the first time you asked, I don't think I answered. I don't know if the email got lost. And
Yeah.
then you reached out a second time. I'm like, oh my Lord. Okay, this is meant to be. I'm gonna say yes, and we're gonna move forward. So I thank you for being persistent and just asking me a second time. I really appreciate it.
My absolute pleasure. Thank you.
Yes. Yes.
Okay.
Have a wonderful day. Thank you.
You too, my dear.
All right. Bye bye.
Bye-bye.